Succes i veterinær praksis, podcast nummer 95. Velkommen til, dyrlæge Søren Pejstrup her. I dag skal vi snakke om den sidste af de store 5 cancertyper. Den sidste af The Big Five. Tilbage i podcast omkring 40'erne, 42, 43 og 44, der snakkede vi om nogle af de andre. Mastcelletumor, lymfomer, osteosarkomer, og så fremme i nummer 50 var det, der snakkede vi om mammatumor. Og så mangler vi så hæmangiosarkomerne, som vi så tager i dag. Hvis ikke du kan huske de her episoder og gerne vil høre dem, så skal jeg nok selvfølgelig sørge for at linke til dem på hjemmesiden, men du kan også spole tilbage til cirka 40'erne der i din podcast-app på telefonen, så finder du dem også der. Jeg har ringet til USA og fået fat i en rigtig dygtig dyrlæge, og hun er dygtig både til det her med cancerpatienter, men også til at formidle, og det er noget, hun øver sig rigtig meget i. Hun holder mange foredrag, hun laver YouTube-videoer og er aktiv på Facebook for at uddanne vores klienter til, at de ikke bare skal i tønden, for at sige det som det er. Og så tænker vi måske tit, at det her med hæmangiosarkomer er noget, der sidder i milten, og der er ikke noget at gøre. Når den springer, så er den hund færdig. Men det er ikke nødvendigvis helt sandt, og der er faktisk nogle af dem her, de har slet ikke cancer, de har noget helt andet, men det graver vi os ned i dag, og det kan du blive meget klogere på. Der er links til de her tidligere podcast og noter for det, vi snakker om i dag. Der er også en video med Dr. Sue, og så er der lidt links til nogle af de profiler, hun har, sådan at du kan grave dig ned i og se, hvad hun har der. Og måske kan du endda bruge det til at dele via dine kanaler på klinikken, eller hvor du nu er. Alt det finder du på hjemmesiden på SIVP95, SIVP.dk/95, og så over til interviewet med Sue. Hi Sue, and welcome to the podcast.
Thank you so much for having me.
So before we start, I need to ask you about your name. I know you have answered about questions about your last name a couple of times on other podcasts, but just here from the start, not to give any confusion, can you please tell us if you are related to the famous Ettinger that wrote the book that we all read?
I am related, but it is not a blood relation. So it is a coincidence that my mom married an Ettinger, and then someone else on my mother's side of the family remarried Stephen Ettinger's father. So it's not a blood relation, but it's a kind of a fun name to have in vet med.
Mm-hmm. Yeah, and maybe also to give some confusion, but now that's out of the way. So I know you quite well because I've seen you online at a ton of places, and you are on YouTube and Facebook, and you have a podcast, and you have you seem to be everywhere. But in the odd case that someone might not know who you are, can you please give us an introduction to what it is that you do, and maybe just a brief introduction, because you have a lot of irons in the fire, we say in Danish.
I do a lot of things. I keep myself quite busy, but predominantly my main job is I'm a boarded medical oncologist in private practice in the metro New York area. I'm actually in Connecticut now, just north of New York City, and I see patients 2 to 3 days a week. 3 days a week, most weeks, unless I'm traveling and speaking. Speaking is my, other thing that I love to do. So I speak 1 to 3 times a month at veterinary conferences, predominantly in the U.S., national conferences, local conferences, regional conferences, anywhere from 1 to 8 talks in a day. So I keep myself busy with travel. Yeah, I know, I'm crazy. The worst I did, because I got tired of listening to me speak, was 14 talks in 2 days in Florida last year. Yeah, that was a lot. And I had one vet come to all of my talks.
Yeah.
Which I thought was amazing, that someone was that interested and I didn't bore him. No, that he was that interested and that he just, he stayed the entire 2 days. Mm-hmm. And then the other main thing that I do online, as you alluded to, is raising cancer awareness through social media, whether that is through Facebook and YouTube and Instagram, just trying to break down the myths and misconceptions that cancer is bad and cancer is scary and that cancer is not treatable.
Mm-hmm. And you also have, I don't know the right English word for it, but you talk about why wait, aspirate, right?
Yes. So that is a awareness program that I started probably about 5 years ago now, and it is a lumps and bumps awareness program to get pet owners feeling their dogs and cats and then bringing those lumps and bumps to us, the veterinarian, so we can aspirate them in clinic, so we can identify cancers early and remove them and then hopefully catch them when they're small, so they just need surgery and not second surgeries and radiation and all that other stuff.
Mm-hmm. Yeah. And I feel that's also some of what you do on YouTube, that you try to tell some of the stories behind your patients and tell us how happy they are, even though they're getting chemotherapy, and you're raising awareness in that way as well.
Yeah, I think, I can tell people that dogs are happy in the back when they're getting chemo, but to see a Labrador or a Golden Retriever or a mixed breed dog laying on the floor, literally wagging their tail as we're giving them chemotherapy speaks volumes. And then they bounce up, because we big dogs we do on the floor, and they bounce up and they want a treat. Like, that just speaks volumes as opposed to me saying, no, they're going to handle chemo really, really well. So it has been fun over the years to see how social media can do that for us and really help us tell those stories. And the lumps and bumps, that one was from me missing a mass in one of my favorite oncology nurse's own dog. Mm-hmm. And it turned out to be a sarcoma, one of those connective tissue cancers. And it needed a really big surgery. And this was a dog I had aspirated 10 lipomas plus, 10 plus lipomas over the 2 years together. So, if for that one, it's me telling a story where I failed, or I personally felt that I failed Smokey and Amanda, my nurse, and how could we turn this into something positive? And again, it sparked, it accidentally sparked this cancer awareness program. And what I love about it is I can help veterinarians find these bumps and empower them to do aspirates, and then empower owners to be involved in their own pet's care. So it's been a fun journey to use social media to raise awareness. And I had no idea that I would be able to do that when I started my Facebook page probably 6-7 years ago. I had no idea what I was doing, to be honest.
And I remember that story about the 10 lipomas because I use it now. Mm-hmm. Actually, I tell a version of it in the clinic where I work, because usually mm-hmm. Clients will tell me that, maybe it's just a lipoma and I don't want to aspirate it because, if it's something I don't want it to treat it anyway. And I tell that story just to tell them that if we actually find it early, we have the possibility to actually cure the dog instead of just waiting and maybe having it die within a year or two.
Yeah, and I tell people, I can't look at a mass, you can't look at a mass. No one can snap us a picture and take a picture of a mass, and we can't tell what it is, so we have to collect some cells. But yeah, you just you made my day telling me that you're using that story in the clinic, because, just it was about 6 months ago, I saw a boxer, and it came in for a heart-based tumor, and it had 4 different masses that mom said she was an MD, so a human doctor. Mm-hmm. I love that. A doctor for people. Yeah. And she said, my vet said they're nothing. They've been there. And they all looked and felt the same. 1 was a lipoma and 3 were mast cell tumors. And you couldn't tell by looking at them. They all looked identical. They felt identical. They squeezed identical. So yeah, we need to be more proactive, and we need to educate pet owners to expect that. So change takes time, as you know. So I'm patient. I'm in it for the long haul, and it's been a fun journey. Yeah.
And that might also be a little bit of a tangent in what we are going to talk about today, but somehow this topic always comes up when we talk about cancer, because of all the feelings and all the misconceptions that are in mm-hmm. that field.
Exactly. I agree.
Yeah. So you started off by telling me that the Hæmangiosarkomas are a crappy one. Why is that?
They're a crappy cancer because they're worth treating, but we don't see the extension in survival times that we see for other cancers. And so even with surgery and chemotherapy, the 1-year survival rate is about 10%. For lymphoma, right, in dogs, when we give them chemotherapy, the median survival time is 13 to 14 months versus a month with no treatment. So for hemangio, you do double to triple the survival times from 1 to 3 months to 6 to 9 months, but it's still, I really like to get my pets out to a year when I'm talking about treating cancers. So that's why it's still a crappy cancer, and there hasn't been a lot of new therapies. There are some things in development in the U.S., with the EBAT, which we could talk about. So I'm excited about that, but it's just a crappy cancer because I feel like we don't do as much for it as we do other cancers in dogs, like mast cell tumors and osteosarcoma and lymphoma.
Yeah. And I think we can all remember a case with a German Shepherd that comes in completely anemic, and we find something in the abdomen. But what kind of patients do we find this type of cancer in?
So the classic dogs are what you said, so we think about it in German Shepherds and Labradors, and Golden Retrievers. Those tend to be some of the breeds the overrepresented breeds. But, I just did go to a talk at one of my conferences, ACVM, the American College of Veterinary Internal Medicine, by Dr. Modiano, who's definitely one of the top experts on this cancer. And he was really emphasizing that this is a cancer that we can see in small and large breed dogs, even though we tend to associate it with those classic breeds. But, any dog of any size can get it. And one of the other reasons that I'll say it's a crappy cancer is there are so many myths and misconceptions by veterinarians about this cancer. We assume that a mass in the spleen is hemangio. And if you look at the statistics, it's about a 50-50 split. We talk about the 2/3 rule. So 2/3 of masses are benign. 2/3 are malignant. And of those 2/3 of them are hæmangiosarcoma. So it's about, 45 to 50%. So I usually just round it up and say it's about 50%. But just yesterday, one of my favorite clients was there with Pokey, a white pit bull who I'm treating for lymphoma, and he showed me a picture of his daughter's dog's x-rays that had a mass, wasn't bleeding, was not anemic, and the vet said there's nothing to do. You should take the dog home for a couple of days and then euthanize. And she did. And, it might not have been hemangiosarcoma. No. So that's frustrating, right? We do know that if they're bleeding, like the German Shepherd that you alluded to in the beginning, if they're bleeding, if they have an acute abdomen and no history of trauma, they weren't hit by a car, the chances of hemangio goes up to 80 to 88%. So there are things that we can do, but there are so many dogs that have splenic masses that we don't know that they have hemangiosarcoma, but I think we tend to err on the side, especially if based on breed, large breed dog and things like that. So I think that's one of the other frustrating things about this is we often don't know what they have and then they get condemned, and that could be really frustrating.
Mm-hmm. So maybe we should take a step back here. So if we want to find these early, what should we look for? What kind of patient comes in the door here, and what should we find on them?
That's a great question, and that's a really aside, right, when you ask that, because it's a hard, early so for lumps and bumps we talked about, like early cancer detection is kind of we as veterinarians can encourage our pet owners to be more proactive. They can, feel their pets once a month, put it on the calendar, but finding masses in the spleen early is difficult, and would probably, I am an advocate of ultrasound and chest x-rays every 6 months in middle-aged and older dogs. It hasn't been shown whether or not that sort of screening process would help us find splenic masses early, but it is one of these tumors that often we don't find until they rupture and bleed. What's interesting, and I'm sure you've seen some of these dogs in your career, is there are some cases that end up coming in with a splenic mass that a couple of weeks ago they were quiet and tired and the owner thought they were off, and then they gained their energy back. And those are the dogs that are probably, and then that happens again, and sometimes they'll have a couple of cycles of that. And those are dogs that are probably having minor bleeds, right? Like mild hemoabdomens, and they absorb the blood and transfuse themselves. So I think those are ones that maybe we need to be more proactive about getting those dogs in and doing ultrasounds and looking for masses in the spleen. But those are the ones, but it's hard to find masses in the spleen until they're really big. So, and as you know, the other thing that's really frustrating is the symptoms, the clinical signs of these can vary from just being tired, right, lethargic, to complete collapse, shocky, white gums, and things like that. So there's not like a very specific clinical sign. You know, for osteosarcoma, I can tell veterinarians and pet owners, if you have a limping dog, you know, that's lame with swelling over a high risk area for osteosarcoma, do x-rays at that appointment. But I think it's a little bit harder with osteo. With hemangio.
Mm-hmm. And I, because I just checked before we started the interview, I checked the book that we started mentioning, that you can also find it as a lump or something in the skin, but I have never seen one.
Hemangio?
Mm-hmm.
Yeah, so you can see hemangio in the skin, the superficial ones, and then you could see it in the subcutaneous layers, intramuscular, and then in the visceral organs. And actually the ones that are truly confined to the skin, the superficial ones, those actually do really well. Those, I think, more of almost like a soft tissue sarcoma, nice big surgery, and a lot of those will go on have very long-term survivals. The subcutaneous ones can actually do a little bit better. Studies show that median survival times is about 1.5 years, but the ones that have good control often, I have one that's out over 3 years now, Claude. And then the intramuscular, and the deeper you go, the worse they get. So yeah, the superficial ones are good.
But I don't see them very often, or I haven't never seen one, or maybe I'm just not looking. I don't know. But are they seldom or?
Yeah, they're definitely less common than the internal ones, than the splenic ones and the heart-based ones and things like that. But, you know, it's a cancer of blood vessels. So anytime you have that malignant transformation, you could definitely get it. But yeah, I don't see them as much. But again, the superficial ones, the skin ones, I hopefully don't need to see. But again, the subcutaneous ones, and I've seen some bad intramuscular ones as well, like golden retriever, middle, sort of in the medial thigh. It actually meted to the chest at the time of diagnosis, so that was a tough one.
Yeah. Okay.
Yeah.
So, so again, there's a bit of two types here. The one that is completely pale, and when it comes in, and then the other one that we might end up being lucky to find because we do an abdominal ultrasound on and find something. But how do we make the diagnosis?
So this is a hard one because dogs are gonna come in. You're probably gonna either do abdominal X-rays or an ultrasound. Preferably an ultrasound is gonna be better. But it's still, you know, as I say, you can't tell with an ultrasound probe whether or not that mass is hemangioma, hæmangiosarcoma, or one of the other differentials. So we want to do 3-view chest X-rays before we go to surgery, but unlike those lumps and bumps where we're going to aspirate it and know what it is before we go to surgery, you need to go to surgery, you need to remove the spleen and wait for your biopsy to come back. And so the reason that sucks is the owner doesn't know, right, before they go to surgery what their dog has. And so they have to wait till the biopsy comes back. So ultimately, you know, we're going to run blood work. We're probably going to run a coag. We're going to hook the dog up to an EKG during surgery. Some, you know, about 50% of them will have arrhythmias that usually resolve before they go home from the hospital by 48 hours. But we are not able to confirm that diagnosis until we get our biopsy back.
Mm-hmm. And that will be for the bleeding patient, or for the one that you are lucky to find for something else?
All of them, you know. So with the bleeding patient, your suspicion of hemangiosarcoma rises. I'm still not against taking those dogs to surgery. You know, I always tell owners, I can't crystal ball for you, but based on the fact that they're bleeding into the belly, I'm more concerned that this could be the bad one. Mm-hmm. But, you know, hemangiosarcoma doesn't mean you should not do surgery and give chemo, because you just need to prep the owners and get them ready. Because again, some owners, even if they're not going to do chemo, you do surgery, you do the splenectomy, the dog recovers, they could have 1 to 3 months of great quality of life. And for the right owner, that's great, right? They get their dog back. You know, otherwise the dog is bleeding into their belly and may need to be euthanized. So, and if they give chemo 6 to 9 months, and some dogs do live longer than that. So I'm not saying don't take a dog with a bleeding mass to surgery. I'm just saying tell the owners it's more likely hemangio so they're not surprised. But I wouldn't condemn a vet just because it's a hemoabdomen at all.
But I'm circling around that topic because as a vet and GP, we sometimes get these in, and we have to make some very quick decisions, and we have to give some good advice based on very little facts, because otherwise the dog dies before we get the chance to euthanize it. So, so if I take let's say radiographs of the dog, is there any clues there that I maybe not should advise it to go to surgery, or should I just, if the owner is up for it, just go ahead and remove the spleen?
There's no way before you take that dog to surgery to know what it is. Whether I've had hemoabdomens with hemangiomas, I've actually had a ruptured splenic mass that we took out and turned out to be lymphoma. They're not supposed to do that. They're supposed to infiltrate the spleen. Yeah. So for me, I think you educate the owner, and then if they're up for it, I would stabilize that dog and take it to surgery.
Okay. So I'm not going to find a big metastasis lump on the radiographs and then say, okay, it's not worth it, or
if there's nodules throughout the lungs, that would change my decision. The hard part with nodules in the liver, especially on ultrasound, is they still could be benign regenerative nodules. Yeah. So, you could go in. Sometimes surgeons will tell me that they can tell, with the nodules in the liver that they look similar to the one in the spleen. But I have also seen dogs that were originally condemned on ultrasounds that there was nodules in the liver and they turned out to be benign regenerative nodules, and it was hemangio that didn't spread. So I just get careful, I get very cautious. Yeah. I would tell you if I could, I promise, I don't want to take it. Like I said, if there's nodules in the lungs, I'm going to have a hard time taking that dog to surgery, right?
Yes, but I'm trying to find where the boundaries for my advice to the owners, but that makes absolute good sense.
It's one of the reasons that these are really hard tumors.
Yeah. Is there any clue if I do an abdominal synthesis, or I want to see where the fluid, I'm guessing there's fluid in there, and I want to see if it's blood or something else, and I get something out. Can I guess it from looking in the microscope?
Nope. Usually, every once in a while, they'll see sarcoma cells on that cytology. But typically, when you send out fluid analysis, if it's usually mostly blood, serosanguinous fluid, it usually doesn't clot, and there's usually so much dilution that you're not going to see sarcoma cells. I think I've had 2 cases in my career where they saw sarcoma cells on the fluid analysis, and your fluid analysis usually, at least where we go, takes about 48 hours to get back from the lab. But even if you just made a smear, I bet you're just going to see blood or diluted blood.
Okay.
And I'm telling you.
Yes. Sorry.
No, that's why these cases suck. Yeah. We know that, studies look at, what about on the CBC, are the anemic cases more likely to be, Hæmangiosarkoma. We do know that malignancy increases with nucleated red blood cells, abnormal red blood cell morphology, the cases that have ruptured. But again, nothing is going to be diagnostic except for that biopsy of the spleen that you remove.
No, of course. Okay. So
it sucks.
And there's no way I'm going to reach the spleen in that case with a very long needle or ultrasound guided.
Yeah, so they typically they're very friable. They're friable at surgery. So when you're taking them out, you need to be careful of iatrogenic rupture as you're taking them out. And that's also the reason that we tend not to aspirate these. So remember, these are cavitated tumors that are typically blood filled. So there's 2 risks of doing the and I love to do aspirates. This is the girl that created a program called Why Wait Aspirate, right? Yeah. So just, remember that. I love aspirates, but splenic masses that are cavitated, those mixed echogenic masses on ultrasound, tend to be non-diagnostic because you just get blood. and they tend to be friable, so they could bleed. You could cause it to bleed if you do a cytology. So this is one time that I say don't aspirate.
So we also need to be careful, even though it's not bleeding massively anyway. So if we end up finding something in the spleen, we should still be careful just to poke a needle in it.
Yep. And so when I have a talk that I do on Hæmangiosarkom. My husband is a internist, so he does ultrasounds at our practice. And I was preparing the lecture, and I said, one of the tips is you can't tell with ultrasound, even if it's a mixed echogenic mass, whether it's Hæmangiosarkoma or hemangioma. So I said, hey, can you send me some pictures for my talk? And so he sent me 2 ultrasound pictures. One was Hæmangiosarkoma and one was hemangioma. And I said, you didn't tell me which was which. And he said, that's the point. And I said, well, I need to know. And he goes, it could be either. But I made him look up in the records to go back and which it is. But the point is, even, you can't tell, even with those ultrasound pictures, a mixed, we often use it looks scary on ultrasound. It looks aggressive. It looks blood filled. That still could be a benign tumor.
Okay. And that's a very important point to get across here, I think, or I feel.
Yeah.
So.
Yeah. I know. I feel like I'm harping on it over and over, but again, I think that's one of the frustrating parts. Going back to my client's daughter's dog, right? Mm-hmm. Like, did that dog have hemangio? Did that dog need to be euthanized? We don't know. And she has pet insurance. She would have done surgery.
Yeah, that makes my heart sink a little bit here.
I know. Yeah.
But I'm circling around here because, as I said, as a GP, I need to know sort of where the boundaries of what I can do with the what I can do and what I'm not supposed to.
Mm-hmm.
Yeah. So let's say that we get the spleen out and we send it off and get the results back. So what else should we do? Should we do blood work? Of course, maybe we have done this because we had the dog in surgery, but is there anything else aside from the radiographs that we need to do?
Before surgery?
Yeah, well, for these cases anyways. So maybe we're not going to talk too much about the surgery, I think. But
okay.
As for these cancer patients, I don't do chemotherapy, and of course I send them off. But some of the work I could maybe do at home in my clinic, even though I don't know what to look for in some of the blood samples. I could draw the blood and do that in the clinic where I work, and then the results are ready when I send it off.
Yeah, so when we're giving chemo, so if we give chemo to a dog after Hæmangiosarkoma, we typically wait until the incision's healed. So I'm usually starting chemotherapy about 10 to 14 days after surgery, around the time the staples or sutures are coming out. And typically the main drug that we're giving is doxorubicin. It's given every 3 weeks for 6 treatments. We will run blood work. We have to check the neutrophil count the day of chemotherapy and up to 24 hours before. So I do have clients that are traveling to see me. They'll go to their general vet the day before to make sure that the white blood cell count is okay, and then come see me the next day. Some owners say, what, that's a pain. I don't want to go to the vet twice in 1 week. I'm just going to come to you. And then we run the CBC in-house that day before chemotherapy. So we're always checking the white blood cell count, the neutrophil count before chemo. And this is going to be a little bit different with your oncologist. The first time I give a myelosuppressive drug, I have them check the neutrophil count. I want to know how low they got. Do I need to adjust that chemo? Especially for my clients that are driving a distance, I will have them do that nadir blood work to check the neutrophil count with you. And that's great, because the other thing that I like about doing that is for general vets who don't have a lot of chemotherapy patients, they're seeing how well they did, because the owner's like, oh yeah, they did great with chemo, and things like that. So it also just helps raise awareness that our chemotherapy patients can do well, because 80% have no side effects. And so, if you've sadly dealt with cancer in your family or in friends, we know people get pretty sick from chemo. And that's all that a lot of pet owners know when you start talking about chemo, is chemo in people. So for them to see that their pets are doing so well is really nice.
Yeah. I'm also asking because I know for mast cell tumors, I was taught that when we get a grade 2 back, we should ask for some more testing on the tissue that we submitted. And I can't remember the name of it, and I don't know how to interpret it when it comes back, but I might as well just order it because it was my patient, and then the result is ready when I send it off to the oncologist. So
there's no... Yeah. So for hemangiosarcoma on the so you're talking about the prognostic panel for mast cell tumors that looks at things like the c-KIT mutation and things like that. For hemangiosarcoma at this point, it's no special stains. It's not like lymphoma where I care if it's B versus T cell. So basically hemangiosarcoma, the biopsy is pretty straightforward and we don't need any additional stains or anything like that in most of them.
Okay, good.
That's great. It's a great question.
Yeah, well, I was going to say, forgive me for asking stupid questions, but or dumb.
No, they're great. Once you said it, I knew exactly what you were talking about. I was like, oh yeah, that makes sense. But no, for hemangio, no special stains or immunohistochemistry or anything like that needed.
Yeah. Oh, okay, good. You talked a little about the prognostics and how long we can expect to have these patients, but maybe we should round off by talking a little about that as well.
Yeah, so in general, with no treatment, because owners always ask, that's going to depend on if they're bleeding or not, right? If they're not having a bleeding episode and the owner decides not to treat, I usually still say probably less than a month, but because we never know if they're going to rupture. For surgery alone, splenectomy alone for hemangiosarcoma, 1 to 3 months. And just remember, you're going to have that dog that lives 6 months after, right? There's always going to be those dogs on the range, and then there are going to be some that only live 14 days after surgery. So I always tell owners I live to be wrong, so our pets are living longer. But in general, 1 to 3 months with splenectomy alone, and then the addition of chemotherapy about 6 to 9 months. We know that dogs that don't rupture tend to do better. That rupture episode is an opportunity for the cancer cells to seed the abdomen, so transplantation. So we know that dogs that don't have rupture, don't have hemoabdomen evidence at surgery tend to do better. And then there's also some studies that suggest that the low-grade ones on the biopsy, which I rarely see, can do a little bit better as well. And as I mentioned, 10% of dogs will get to the 1-year anniversary. What's interesting is one of the other new lectures that I went to does suggest that those dogs that make it past a year can do well. Like, that's a really critical point. I had one dog named Gunner that I was treating for lymphoma, and he was about 17 or 19 months out from his lymphoma. And I don't know if you guys celebrate, that's not really celebrate, but we have April Fool's Day, where people play jokes on each other. And on April Fool's Day, Gunner, the German Shepherd, had a bleeding splenic mass, and we took him to surgery, and it was lymphoma, hemangiosarcoma. And she said to me, I'm going to get this dog out 1 year. And on April 2nd, the following year, the dog ended up, it had meted to his liver before that, but it was funny. She was like, I will get this dog out a year. But other studies do suggest dogs that get out a year can do better. But again, getting them out to that 1-year anniversary is tough.
Okay. All right. And
the other, I just want to mention real quickly, it's still in clinical trials, but I believe it's the University of Minnesota. Dr. Modiano and Borgata are working on this new compound called EBAT. It's an engineered toxin that targets some endothelial cells, growth factors, and it has a cool mechanism of action, and so it looks like that could be a good treatment. It's not clinically available yet, but it does look like it's extending survival times in dogs, and they actually have a screening study going back to your question in the beginning where they are looking at Goldens, Boxers, and Portuguese water dogs, and they run blood work looking for these markers, and then they're going to see if they give them this compound, could it help prevent the cancer as well if they have these markers. So I'm just excited that there's something new to report for hemangiosarcoma, even if it's years away. And I'm just looking at my notes, and I do believe it's the University of Minnesota.
Okay. And one last question in regards to this anyway is what are they going to die from, or what ends up killing them?
It's a great question. So usually it's metastasis to the liver. It can also metastasize to the lungs. When it metastasizes to the lungs, it's more of your typical metastasis patients where they're just slowing down their energy. Maybe they're coughing a little, but usually they're just sort of slowly sort of fading kind of thing. The ones that are a little bit more dramatic are the ones that metastasize to the liver, because then they have these multiple masses that are bleeding. And again, if it's a slow bleed, the dog can transfuse themselves and recover from that. But, again, when they have these multiple masses that are bleeding in the belly, it sucks because it's sort of that repeat for the owners in that, it brings back the flashbacks of what happened when their dog had the bleeding splenic mass. So usually it's the liver metastasis and or lung.
Yeah. Okay. All right. That was actually the end of my list of questions here. Do you have anything else you feel is very important that we get mentioned here?
No, I think we covered all the important salient points. I do think it's a tough cancer, and I'm so optimistic about treating cancer, and this is definitely one of the tougher ones. So I, feel like it's always a little bit more depressing, but I have to tell you, for the owners for some owners, 6 months is a really long time for them. And for some owners, a year's not long enough. And for the owners that treat for hemangiosarcoma, I find them to be very thankful for the dogs that get out 6, 7, 8 months. Those owners usually have no regrets about doing it. I think they know what to expect. And so I wouldn't say just because it's hemangio, don't offer chemo.
Okay. Thank you. I think we should also talk a little about of your online adventures as well, because just to I'd like to talk about it because we sometimes struggle to find something to share on social media or something to write about on our websites, and as I mentioned, I had a very good story that I can now use in my clinic that I got from you. So I will encourage everyone listening to go find you on the platform that they most like. And because you're everywhere, people can actually pick and choose where to follow you. But maybe you should mention again where's the best place to find you and where are you online?
Yeah, so probably the two best places are, the biggest one is Facebook, Dr. Sue Cancer Vet. And so it's a mix of stories, usually celebrations, milestones, dogs that are finishing chemo, cats that are finishing chemo, coming in for their rechecks. I also do share stories about pets that passed away, whether they're a long-term survivor or short-term. And I find that those really resonate with, I think sometimes as veterinarians, you're scared to share those stories, but they do resonate, and there's a lot of empathy and support from the community. I'm always surprised how many pet owners not only share their condolences for the family, but worry about me as their caregiver. So I share stories there. And the other thing that I've been doing on Facebook in 2018 is each month we pick a tumor type, and my social media friend helps me put together infographics about those tumors. So we did, January was all about dog lymphoma, and then we did cat lymphoma. I think we spent 2 months on mast cell tumors. And so we have these great infographics that you're more than welcome to go and just share them right onto your page. The easiest place to find when we're done with a series, so right now, coincidentally, we're doing hemangiosarcoma, but if you go to the album section under photos, you can just use all the lymphoma ones, or you can just share them a day, pick a month and, post them every couple of days. I'd be more than happy. But those are for pet owners, and they really like those information because a lot of it's about what to look for and things like that. And then on YouTube, I'm doing vlogs, so video blogs about what it's like a day in the life of the clinic with me. So I show dogs getting x-rays and chemo and blood work, and they're a little bit goofy and a little bit fun. And then I've also have some informational ones like myths and misconceptions about chemo, medications your pet should have if they're going through chemo, nausea medications and things like that. So trying to make those as the YouTube channel as a place where people can go for information as well. Yeah.
And you've been featured in quite a lot of other veterinary podcasts as well. So I think I'll try to find some of the best links and link that to some of the podcasts as well in the show notes.
Yeah, thank you.
And you have a podcast as well, also, don't you? Or
I co-host a podcast, which makes it very easy for me because Tracy Hotchner does most of the work for it in terms of the editing. I know the amount of work that goes into your podcast. But what we do there is usually it's people who email me looking for advice on their pet. And as you know, I can't give advice about a specific pet, but I can talk about lymphoma in dogs or hemangio. So we have callers that we talk to on the podcast and try to answer their pet questions. But I love being guest on other podcasts as well because it's fun just to talk about different things. I love it.
But thank you very much, Sue. It was very nice of you to take some time out to talk to us and share a lot of your very large knowledge. Is that a correct term in English? I don't know, but it is in Danish anyway. Thank you very much.
No, it's perfect.
Thank you.
Thank you so much for having me. Truly an honor to be here.
Husk at gå tilbage i podcaststrømmen og find de her tidligere podcast om de 4 andre af The Big Five. Du finder dem tilbage i 40'erne. Hvis ikke du hører podcast på mobiltelefonen, så kan du i din App Store, og det er uanset om det er Android eller iPhone, finde en app, hvor du kan downloade alle de her podcaster. Der finder du også masser af Monopolet og De Sorte Spejdere og meget andet. De her tidligere podcast, de ligger tilbage omkring 40'erne, og du finder dem selvfølgelig også på hjemmesiden, og jeg skal nok sørge for at linke til dem i shownoterne til dagens afsnit. Der sørger jeg også for at linke til de profiler, som Dr. Sue hun har og hendes hjemmeside, og der ligger også en video, så du kan se, hvad hun er for en starut. Alt det finder du i shownoterne til det her afsnit på SIVP.dk/95. SIVP.dk/95. Tak for i dag.